An ambulance crosses through the angry demonstration in front of Belvitge Hospital. We're in Barcelona, the capital of Catalonia in northeast Spain. Since the regional government's decision to cut public health spending, there have been mass protests. Medical staff, patients and civil society groups are on the streets on an almost daily basis. Among them, many elderly people, defending the public healthcare system. Today the protesters are involved in a slow stroll across the 4-lane motorway connecting Barcelona to the international airport. At the front, we see Antonio and his wife Ursula. The couple take part in the demonstrations as often as possible. Antonio, who spent his whole working life in the chemical industry, suffers from cancer. He has already undergone 4 operations.
I'm trying to stop all the cuts that the regional government wants to implement. Lengthening waiting lists costs me precious time, too much lost time for me and for my cancer treatment.
I think the cuts are bad and very dangerous. We're old, nobody wants us, and nobody wants to help us. And as for the private social security system, they have no interest at all in taking on elderly people. They don't want them. So we need to defend the public healthcare system.
Entonces, bueno, hay que defenderla y además porque pienso que es la mejor.
Y para hacer ruido. Que nos escuchen, que nos oigan.
Unionists from the medical profession invited the Barcelona protesters to come to the regional government building of the Catalonian capital. Homemade placards caricature the Catalan health minister, calling him the destroyer of the public health system. Other Spanish and European regions with similar budget problems are keeping an eye on the Catalan conflict. The key question: what is the right mix between private and public healthcare? Antonio meets his friend Roger, president of the Catalan Public Health Defence Association. Roger accuses the government of a hidden agenda, using the crisis as an opportunity to implement privatisation measures. There is a risk that underpaid doctors could switch from the public to the private sector to get better pay.
Doctors and medical staff in general are very angry with the situation. So far they've worked properly and made a huge effort, but despite this they're earning less. Doctors' wages are getting lower and lower. Here in Catalonia, doctors have the lowest salary in the whole of Spain, and Spain has the lowest salary for doctors in Europe.
The quality of the healthcare system is worsening. There are whole hospital departments being closed. Waiting lists are getting longer and longer. Patients are being held in the emergency room for several days at a time before they can get a bed in the main part of the hospital.
But on the other hand, there are facts and figures showing that during the past, some public health structures suffered from chronic mismanagement. The annual budget was often already spent by September, and quite a number of public hospital managers did close to nothing to control the costs. Last year, the regional government changed from centre-left to centre-right. And the regional health minister of Catalonia has put pressure on hospitals to stop the financial hemorrhaging of the public sector, saying that just a third of retiring medical staff will be replaced, expensive techniques should be used in a more cost-efficient way, hospitals have to stick to their yearly budget allocations, and medical staff get a limited time per patient. In the short term, €1 billion have to be saved.
Due to the reduction of the incoming tax resources, there's an obligation for us to reduce the costs of the public healthcare system in Catalonia. And this had 2 important consequences. Firstly, the salaries of the medical staff were reduced, the working conditions changed. And secondly, waiting lists for patients grew longer. But in no case did this mean less healthcare or fewer services for patients in Catalonia.
Cap prestació de les que té dret qualsevol ciutadà de Catalunya.
The health minister recalls that there are no waiting lists for cancer patients and that every waiting list is double-checked by doctors to avoid health risks. But Antonio has a different experience.
Boy Ruiz lies when he says that people do not have to worry. He lies when he pretends there's no problem with waiting lists getting longer. I'm living proof. One time when I was on my way for an operation, I had to turn back home again because there was no anaesthetist in the hospital.
In the long term, the reform could mean a reorganization of all hospitals, meaning that each hospital would specialize in different areas. Many experts agree it's not cost efficient for every hospital to offer every service.
In the last decade, the public expenditure on health increased 40% per capita in Catalonia. And we covered everything to everybody. So it's like a miracle. And of course, miracles don't exist. In the rest of Europe, they don't cover that much. The problem we have now in Catalonia is common in all the regions in Spain. We have overspent. All the regions will need to cut. We have to make sure that any new device, any new drug, when we fund it with public resources, this complies some cost-effective criteria.
Rural areas are also concerned. In the small town of Soria, we meet pharmacy owner Ramon Garriga Perez. For him, the day draws closer on the day that he might have to close the shutters for the last time on the pharmacy that his father opened in 1935.
Actualmente se venía cobrando.
Until recently, we were used to receiving the government reimbursements within 60 days, and the pharmacy was able to cope with us. But since August, the delay has been 105 days, so pharmacies right now have a problem to pay their suppliers on time.
Ha llegado un momento que no se puede hacer frente a los proveedores.
To put pressure on the drugs industry, lawmakers introduced price regulations. And since 1996, prices fell. Nevertheless, experts say the system is still far from perfect.
If you're a rich pensioner, a rich over 65 years old, you get drugs for free. On the other hand, if you are unemployed and you are under 65, you pay 40%.
Back in Catalonia, it's wake-up time for the sleeping suburbs. The tenement blocks of the popular Belvige neighborhood were built in the 70s when poor migrants from southern Spain settled to work in rich Catalonia. When the government announced the closure of the primary healthcare centre, based at the bottom of the multi-storey buildings, neighbours moved in and occupied it. Each evening at 9 o'clock, it's saucepan-hitting time. Almost 30,000 people live in the area.
A lot of people live here in Belvitge, among them many elderly and disabled people who have problems with mobility. We fought for 31 years to keep our medical centre open. Given the very dense population around here, we could do with 3 primary healthcare centres. Instead, they want to close this one here.
German lessons at the Barcelona-based Goethe Institute are fully booked. The institution prepares special language lessons, German for healthcare professionals. Youth unemployment is 46% in Spain, while Germany is looking for a qualified workforce. Language teacher Arnim Schulz asked the medical students of their plans for the future.
A lot of doctors are needed in Germany, so for us it's easier to go there to find work.
Well, in my opinion, it's a good achievement by the European Union that we can move freely everywhere and we have the right to pick up work elsewhere in Europe.
In Catalonia, as well as Spain as a whole, and the other crisis countries in Europe, there is a problem. A medical brain drain. The exodus of doctors and nurses has already started.